Ever pondered the workings of medications like sildenafil? Well, today we delve into the science behind this commonly prescribed drug. Sildenafil, widely recognized by the brand name Viagra, is a medication primarily used to treat two conditions: erectile dysfunction and pulmonary arterial hypertension. These may seem like vastly different issues, but the mechanics behind sildenafil's effect on both are surprisingly similar. Imagine a city where traffic is a constant problem. The cars represent the blood cells, and the city's roads are the blood vessels in the body. Now, what if we could widen those roads to allow more cars to pass through simultaneously? This is essentially what sildenafil does. It works by relaxing and expanding the blood vessels, thereby increasing blood flow to specific areas of the body. In the case of erectile dysfunction, sildenafil enhances blood flow to the penis, aiding in achieving and maintaining an erection. For pulmonary arterial hypertension, it improves blood supply to the lungs, reducing the workload of the heart. However, just as city planning requires expert oversight, so does the use of sildenafil. It's crucial to use this medication under medical supervision. Why, you may ask? Well, sildenafil may interact with certain other medications, leading to unwanted side effects. It's like adding more cars to the road without considering the capacity of the parking lots. In summary, sildenafil is a unique medication designed to increase blood flow to specific areas of the body. It's widely used to treat erectile dysfunction and pulmonary arterial hypertension. But remember, it's essential to use it responsibly and under medical supervision. So the next time you hear about sildenafil, you'll know exactly how it works. It's not magic, just good old science.